sa ating 37th Kapihang OH. Ladies and gentlemen, our PCOM Quezon City Chapter President, Dr. Catherine Artaiz-Cariaga.
Maraming salamat, Dr. Ku. Magandang gabi po sa inyong lahat na aming tagapanood at tagapagsubaybay mula sa iba't ibang panig ng Pilipinas at sa labas ng bansa. Sa aming kapamilya sa Philippine College of Occupational Medicine, mga kapuso sa Occupational Safety and Health, at kapatid sa propesyon ng kalusugan, isang mainit na pagtanggap mula po sa amin na bumubuo ng PCOM Quezon City Chapter. Kapaghamong mga taon na lumipas, ngunit ang COVID-19 ay patuloy pa ding namamayagpag sa buong mundo. Sa Pilipinas, dala na res bakuna ng gobyerno, unti-unti na bumababa ang kaso na tinatamaan na sakit na ito. Ang lahat na sektor ng lipunan ay patuloy na nakakaahon mula sa pagkakalugmok ng ekonomiya dala ng pandemya. Maraming mga protokol at programang magbibigay benepisyo ang nilatag na ng gobyerno sa ating mga mamamayan, lalo na sa ating mga manggagawang Pilipino. Katuwang ang pribadong sektor upang patuloy na pasiglahin ang mundo ng paggawa. Kaya po ngayong gabi sa aming ika-15 anibersaryo ng pagkakatatag ng PCOM Quezon City Chapter, kami ay lubos na nalulugod dahil kasama po natin ang 4 na mga eksperto sa larangan na ito sa ating ika-37 Kapihan para talakayin ang tulong sa manggagawa sa gitna ng pandemya. A panel discussion with SSS, PhilHealth and ECC. Sa muli, happy 15-year anniversary sa ating lahat na bumubuo at tumatangkilik sa PCOM Quezon City Chapter. Naway pagpalain po tayo ng poong may kapal upang patuloy po kaming makapagbigay ng kaalaman, pag-asa at liwanag, dala ng karimlan ng kasalukuyan. Maraming salamat po at isang ligtas na gabi po muli sa inyong lahat.
Maraming salamat, Dr. Artaiz-Cariaga, our PCOM Quezon City Chapter President. Happy 15th anniversary in each and every one of us. Now, it is my great pleasure to introduce our 4 speakers for tonight. Ladies and gentlemen, my dearest colleagues, and all our beloved guests of all sectors of workplace and workforce, no? We're very honored that napaunlakan tayo ng ating mga panauhing dangal. Okay, so sisimulan ko po ang introduction ng ating speaker for tonight. One of our speaker will be Ms. Merla Rose David-Reyes, RPh. She is the head of the product team for special benefits, PhilHealth institutionalization of the benefit development protocol, introduction and evaluation of social health insurance benefits. She helps in developing the Z benefits, and she is also part of the team that develops and updates the benefit packages related to the COVID-19 pandemic. She is Ms. Merla Rose David-Reyes, RPh. Our next speaker will be from Philippine Health Insurance Corporation, Abigail Romero-Estrada, RN MPA. She is a nurse, head of the product team for inpatient benefits, currently, technical support, formulation and implementation of guidelines, team lead, technical groundworks on the reforms on provider payment, institutionalization of costing healthcare services to inform realistic rates. Our next speaker is Dr. Roberto U. Putong. He is a medical program under Department of SSS, Medical Program Department, SSS, Department Manager 3, currently, Acting Head, Concurrent Acting Head, Supervising Medical Specialist 4, OIC Department Head, Senior Physician 2 MNIM, Junior Physician and Assistant Physician. Develop guidelines, procedures, manual, and forms for the following: business process, re-engineering, online filing of sickness benefit, new disability program, annual confirmation of pensioners, SSS card reader, and citizen charter. He is also a Doctor of Medicine from Angeles University Foundation. Last but not the least, Attorney Jonathan T. Villasoto. He is on the Employees Compensation Commission. He is the Deputy Executive Director, Division Chief, Appeals Division, and concurrent OIC Deputy Executive Director, Legal Officer 4, and concurrent PIC Division Chief, Appeals Division, Legal Officer 3 and 2. He has his Bachelor of Laws in San Sebastian University, and he has his AB Political Science in Far Eastern University. Okay, ladies and gentlemen, these are our speakers for tonight. Now, may we call our previous Philippine College of Occupational Medicine National Board Secretary and Public Relations Officer, and our current PCOM Quezon City Chapter Auditor, our moderator, Dr. Marilu Renales, too.
Thank you so much. Maraming salamat ulit, Dr. Venus Ku. Ang ating first speaker ay si Ms. Merla Rose David-Reyes. She is the head of the product team for special benefits, Philippine Health Insurance Corporation. So let's welcome Ms. Merla.
Dr. Renales, may I turn over the floor first to my colleague, Ms. Abigail Estrada.
Okay po. So, next slide please. Next slide please. Okay. So, nasan na po si, ayan. So, may call on si Ma'am Abigail Romero-Estrada. So, ating i-introduce muna po siya sa atin, sa inyong lahat. Siya po ang head ng product team for the inpatient benefits and then the technical support, formulation, and implementation of guidelines. Team lead technical groundworks on the reforms on the provider payment. So let's welcome our first speaker from PhilHealth, si Ma'am Abigail Romero-Estrada. Sige, ma'am. Please go ahead.
Good evening. Can you hear me po?
Yes, ma'am. Very much. Very clear.
Okay. Good evening to everyone. Thank you for inviting PhilHealth to this Philippine College of Occupational Medicine Quezon City Chapter forum, particularly on COVID benefit packages. May I request po to share our slide, please?
Yes po, Ms. Abigail, you have access for sharing your slides po. Thank you.
Okay, thank you po. May I request my colleague, Ms. Merla, to kindly please share the screen, please, or the slide rather. Thank you. Okay, so I am from the Benefits Development and Research Department of the Philippine Health Insurance Corporation, and I will be presenting to you the PhilHealth COVID benefit packages. For the outline of my presentation, I will be discussing the background and the COVID-19 benefit packages, as well as the summary. So PhilHealth is the largest purchaser of health services in the country today. It maintains a single health insurance fund from which payments for benefits available to members are drawn, and it administers the social health insurance program of the country, which is anchored on the concept of risk pooling and social solidarity, and draws inspiration from the Filipino trait of bayanihan. So this is the PhilHealth's vision and mission, which is we assure that bawat Pilipino miyembro, bawat miyembro protektado, kalusugan ng lahat sigurado. And our mission is providing benepisyong sapat at serbisyong de kalidad para sa lahat, and with our values on integrity, innovation, accountability, commitment, customer focus, equity, and social solidarity. Next slide, please. Okay, so the Universal Health Care Act is guided by 4 key principles that we as a nation should adopt integrated and comprehensive approach to ensure health literacy, healthy living, and protection from hazard and risks. Also, that this goal leads to that we develop a healthcare model and provides comprehensive health services without causing financial hardship to our citizens, specifically the poor and the marginalized members of the society. And we need to pursue a whole of a system, a whole of government, and the whole of society approach in the development of our health policies, and adhere to a people-oriented approach centered on our people's health needs and well-being. Next slide, please. So as part of the entitlement under the UHC, our patients can now expect immediate eligibility in all healthcare services. And there will be no co-payments in basic or service ward accommodation, whether in public and private care facilities. So co-payment will apply to patients who prefer to avail additional amenities over and above the basic accommodation. And the current PhilHealth benefit packages will not be reduced, and when necessary, additional benefits will be designed for directly paying members. Next slide, please. So in PhilHealth, we implement different kinds of benefits. So we have inpatient benefits. We also have catastrophic or Z benefits, or these are the benefits for selected catastrophic medical condition that will require hospitalization, extremely expensive therapies, and other treatment that can deplete families' financial resources. And we also have benefit packages for day surgeries and outpatient treatment procedures, such as TB benefit package, outpatient HIV package, and hemodialysis. And also included in our benefit packages are the outpatient benefits, which includes consulta, which is the primary benefit package. Next slide, please. So as this time of pandemic, we will be focusing on the benefit package for the spectrum of care for coronavirus disease 2019, also called the COVID-19. Next slide, please. So for COVID-19, PhilHealth aims to cover the spectrum of care from testing, community isolation, and hospital admission. So here are, as you can see in this slide, these are the benefit packages for COVID-19 and the corresponding rates or payment mechanisms that being applied to these benefit packages. Payment mechanism we're in, this is how we pay our providers, our healthcare providers who directly provided direct health care or direct management of care to our patient member. Next slide, please. So to discuss it specifically, for our benefit regarding the COVID-19 or SARS-CoV-2 testing, or we call that RT-PCR testing, here are our benefit packages. Next slide, please. So eligible for SARS-CoV-2 testing are PhilHealth members who are in the priority subgroups as classified by the Department of Health. So this is published through our PhilHealth Circular 2021-0021 and can be availed in accredited facilities or DOH licensed testing laboratories. So the complete services or minimum standards included in this benefit package are screening, specimen collection, specimen handling, conduct of RT-PCR testing, including the test kits and supplies, and analysis and reporting of result. So we have two kinds of COVID-19 testing package, and that includes the plate-based RT-PCR and the cartridge-based RT-PCR. Our plate-based RT-PCR, this is an RT-PCR test that entails distributing RT-PCR reagents as the proper concentrations and mixing them with individual samples. As compared to cartridge-based, this is an uses automated instrument which integrates sample preparation and for the detection of the target of sequence. So we have different kinds of benefit amount for this. So also, if the services for this testing are all given and all provided, including the supplies, it amounts to 2,800. But if the test kits are donated to the laboratory, it is paid at the rate of 1,200. And if the test kits are donated and the laboratory is being subsidized by the government, we pay at the cost of 800. As compared to cartridge-based, it is also in tiered payment based on the requirements being applied for, such as if there are free test kits or if it is subsidized by the government. So here are the payment amount or the package amount for the SARS-CoV-2 testing. Next slide, please. The other benefit package for the spectrum of care for COVID is the Community Isolation Benefit Package, or we call that CCIBP. Next slide, please. So the benefit package, we implemented this in 2020 under the PhilHealth Circular 2020-0018. So this is the provider payment mechanism for this is a case rate. So we pay this benefit package on a fixed rate basis, paid per claim, and it is being claimed, or the targeted facility for this benefit package is the community isolation unit. So the package amount costs 22,449 pesos, wherein it is being required that the patients has to be admitted in that facility for 10 days unless otherwise indicated. So it has to be noted that claims will be paid if the patient expires during course of isolation, or claims will be paid if the patient is transferred to higher level of facility as required based on the status of the patient. And there have been amendments to the policy as cited, wherein from 14 days of isolation, we reduced the length of stay to 10 days. Next slide, please. So the service inclusion for this benefit package includes all inputs and activities within the entire episode of care and in the CIU, including payment for obstat and professional fees, medicines, diagnostics, transport, and other operational costs. Next slide, please. Okay. And also included in this benefit package are drugs and medicines as specified in the DOH Department Memo 2020-0123. As you can see, that includes antipyretic, respiratory medication, anti-inflammatory, anti-diarrheal medications, and others as specified in the policy. Next slide, please. So also included, aside from medicines, drugs and medicines, this package also includes diagnostics and imaging. So that includes CBC, other blood chemistry, and chest X-ray, CT scan, or ECG. Next slide, please. Okay, So the next one is the COVID-19 Home Isolation Benefit Package. So the Home Isolation package aims to rationalize use of higher facilities to focus on moderate, severe, and critical cases. As you all know, during uh, the later part of 2020 and the earlier part of 2021, we have again surge of patients no nagkaka-COVID-19. So that's why PhilHealth implemented this home isolation benefit package. So this package will cover COVID-19 confirmed patients with a positive RT-PCR result, which may be asymptomatic or with mild symptoms like fever, cough, diarrhea, and sore throat. More importantly, the patient shows no signs of pneumonia and has no risk factors. And the patients availing of this package must pass the social criteria or other criteria as specified by PhilHealth. Next slide, please. So the benefit package is being paid to the accredited facility, at the rate of 5,917 pesos. So the entire package shall be paid only to the providers. Hindi po siya binabayad sa member, but to the healthcare providers. Next slide, please. So the inclusion of this benefit package we call home isolation includes a 10-day isolation care, physician consultation at least twice for the duration of isolation, and there are 24/7 daily monitoring by a clinician and supportive care by a nurse. And this also needs that the provider has to provide the home isolation kit, and if there are changes in the status of the patient that needs referral, that patient must be referred to a higher facility that is near to the home isolation area. And also the package includes patient education, how to use pulse oximeter, which is included in the kit, to orient them what are the signs and symptoms to watch out for, and the proper disposal of waste, as this is a highly contagious disease, so kailangan yung waste disposal is appropriate, and other needed information for the benefit of the patient. Next slide, please. So this slide just shows us what are the inclusion of the home isolation kit. So it includes alcohol, face mask, thermometer, pulse oximeter, as well as drugs and medicines. Next slide, please. Okay. So also included in this benefit package is the provision of telemedicine, because since we are really decongesting the higher level of facility and in home isolation, the telemedicine is beneficial. So to facilitate access, the package allows the use of freeware applications that can be used to provide teleconsultations. This includes Zoom, Viber, or FB Messenger. So the package also allows providers with contracted telemedicine providers or those using a telemedicine platform. So that is also a part of the benefit package, which is being paid on a fixed rate. Next slide, please. Okay. Then for the other spectrum of care or other benefit package related to COVID-19 is the inpatient benefit package. Next slide, please. So as you can see, the benefit package are different depending on the severity of the cases of our patients admitted in the hospital. So we pay from mild case type to critical case types of COVID-19. So it also differs in level of facility. As you can see, mild and moderate can be admitted in levels 1 to 3 hospitals, but for severe and critical case types, the patient has to be admitted in the higher level facility from level 1 to 3 because there is a need that we have to look into the capability of the facility to manage the our patients under who are suffering from severe and critical case types of COVID-19. And also, this benefit package are paid depending on the severity. So as you can see, the package amount are reflected in this slide, and it is being paid based on the actual charges. So if the benefit package that you can see, for example, for mild cases, depending on the actual charge or the actual amount based on the billing statement or the statement of account, we only pay accordingly. But if the actual amount is exact on the benefit package that we pay the full. So depending on the actual charges of the patient. And also for the inpatient, we also have the full financial risk protection for Filipino health workers. This is based on the Bayanihan law. So we pay full billed amount after appropriate deductions, and we call this that the benefit package or the payment mechanism we use is the fee for service. Next slide, please. So the benefit package for COVID is basically for confirmed cases po, no? So they have to submit a confirmed result of RT-PCR. And for the complete services or minimum standards, the following are the mandatory services included in the benefit package. So that includes accommodation, management monitoring, laboratory or imaging, the medicines, as well as the supplies and equipment. So all these are the services covered by our inpatient packages for COVID-19. Okay, next slide, please. Okay. So in summary, PhilHealth benefits includes inpatient, outpatient, Z benefit or our catastrophic benefit package, and the consulta, which is our primary care benefit package. For the spectrum of care of COVID-19, we pay for the RT-PCR testing, we pay for the home isolation and community isolation benefit package. We also pay for the inpatient benefit package for COVID-19. So I think that's my last slide. Thank you for your attention, and thank you, Ms. Merla, for sharing this slide. Thank you.
Yeah, thank you so much, Ma'am Abigail. Very, very interesting and comprehensive. Tamang-tama po yung ating brief summary also. Our next speaker is also from PhilHealth, and we would like to welcome Ms. Merla Rose David-Reyes. So, Ma'am Merla, she's the head of the product team for special benefits. Ma'am, please go ahead, ma'am. Ms. Merla.
Thank you. Good evening, everyone. And we would like to thank the Philippine College of Occupational Medicine, Quezon City chapter for inviting PhilHealth to this webinar. I am Merla Rose Reyes, and I am the head of the product team for special benefits under the Benefits Development and Research Department of PhilHealth. Now, I'll be presenting to you the implementing guidelines of the COVID-19 vaccine injury compensation package. But before I continue, may I ask permission to turn off my video to facilitate a seamless presentation, please? Okay, so this will be the outline of my presentation. It covers three main topics, namely the background, the objective and validity, and the salient provisions of the policy on the COVID-19 vaccine injury compensation package. The Section 10 of Republic Act 11525, otherwise known as the COVID-19 Vaccination Program Act of 2021, provides for the creation of the COVID-19 National Vaccine Indemnity Fund to provide coverage for serious adverse effects following immunization. Further, the same section assigns PhilHealth as the fund administrator and authorizes the corporation to pay compensation for the indemnity fund. The COVID-19 Vaccine Injury Compensation Package, or VICP, aims to provide compensation for any vaccines administered through the COVID-19 vaccination program in case of hospital confinement, permanent disability, or death due to severe adverse effects. This shall be valid until terminated by the President of the Philippines based on the recommendation of a permanent committee for a span of 5 years, or until the completion of the Philippine COVID-19 vaccination program, whichever comes earlier as specified in the said law. Now let's proceed to the salient provisions of the policy on COVID-19 Vaccine Injury Compensation Package. We see this as very timely po, no? Kasi the vaccination of children started last week and a lot of people now are getting their booster shots. So there are two classifications of the COVID-19 Vaccine Injury Compensation Package. First is the compensation for hospitalization, which is capped at 100,000 pesos per beneficiary. And this is based on the remaining charges on top of the deduction of PhilHealth benefits and other applicable benefits. This may be availed of by the principal beneficiary more than once as long as the limit of 100,000 pesos is not yet consumed by the principal beneficiary. Now, the second classification covers for either disability or death, where a lump sum of 100,000 pesos is paid to the principal beneficiary or the claimant. Claims for permanent disability or death shall only be compensated once in a lifetime. Any claim for death following permanent disability shall be denied, provided that initial compensation has already been paid on behalf of the beneficiary. Retroactive claims for permanent disability following the death of a beneficiary shall likewise not be reimbursed, provided that the compensation for the death has already been paid. Now, for beneficiaries who died or became permanently disabled due to severe adverse effects following immunization against COVID-19 during or after hospitalization are eligible to reimbursements for both hospitalization and the permanent disability or death. Now, here are the features of the COVID-19 VICP. It applies to claims for hospital confinement, permanent disability or death due to severe adverse effects from COVID-19 vaccines that are only administered through the COVID-19 vaccination program of the Philippines. These are for cases with established causality for individuals inoculated from March 3, 2021 to March 2, 2026, or until the completion of the COVID-19 vaccination program, whichever comes earlier. Next, this does not apply to claims already compensated or subject for compensation through the COVAX no-fault compensation program. And lastly, the cases should undergo causality assessment by the NAFIC. It's the National Adverse Events Following Immunization Committee, which is lodged at the DOH. And it should be found, the case should be found to be either vaccine product related reaction or vaccine quality defect related reaction. So if we look at the WHO Manual on Causality Assessment, ang magfo-fall lang po for this benefit package are those classified as A1 and A2 type of adverse event following immunization from COVID-19 vaccine. Now let's go to the claimants for the COVID-19 VICP. This is limited to the primary and secondary beneficiaries ranked according to precedence. In cases of death or permanent disability, where the principal beneficiary is unable to file their own benefit, it's the legal spouse, or in the absence of a legal spouse, any legitimated or acknowledged illegitimate children will be allowed to claim. Pag illegitimate children po, there's a law that says only 50% of the original amount will be given to illegitimate children. Now, secondary beneficiaries, such as legitimate parents, siblings, or individuals issued with a special power of attorney may file the claim in behalf of the principal. So the claims requirements, the slide on your screen shows the documentary requirements for processing of claims. It differs, no? Depende po sa type of claim na i-file ng ating mga beneficiaries. And just for your information, the causality assessment here is not really expected to be submitted by the claimant, but PhilHealth will secure this from the Department of Health as a result of the causality assessment of the NAFIC, or the National Adverse Event Following Immunization Committee. Now, this is a special form, the Vaccine Injury Assessment Survey, and this is submitted as one of the documentary requirements for the Vaccine Injury Compensation Package. This should be filled out and conducted by the attending physician describing the serious adverse event. So even if the claim for the Vaccine Injury Compensation Package is directly filed by the patient, there should be an attending physician licensed by the PRC who should assess the patient and comply and fill out the Vaccine Injury Assessment Survey. Now, there are additional requirements depending on the status of the payment.
Yes.
And the beneficiary fills out that if the claimant is not the principal beneficiary, there are corresponding documentary requirements that is flashed on your screen. And I already discussed the causality assessment also. Now, what are the claimable cases? So these are the cases of hospitalization. Mga examples lang po yan. You can see the whole list from the PhilHealth Circular 2021-0007 Annex B. And it is not really a hard list though. It can be updated based on availability of evidence. For the permanent disability and death, ayan po yung mga conditions na pwede, and these are also, especially the permanent disability, these are also assessed by attending physician. And that's my last slide. For additional information, you may contact the PhilHealth Action Center at this hotline 8441-7442 or email us at actioncenter@philhealth.gov.ph. Thank you for listening.
Thank you very much.
Thank you, ma'am.
Yes, Ms. Merla? Yeah, thank you so much. Buti na lang po ang internet nyo ay malakas pa rin. At natapos po natin ang inyong napakagandang session. And this is really one of the updates on the package. And it includes already the vaccine injury compensation package. So at this point, we are going po doon sa susunod po nating speaker. Pero this time, it will be about SSS na atin talagang gustong marinig po. Especially at this time, kailangan po natin ang mga benefits po niyan. So let's welcome the Department Manager 3 of Social Security System, Dr. Roberto Putong. Sir, it's your turn.
Hi, good evening.
Good evening.
Yeah. First of all, I'd like to thank PCOM Quezon City Chapter for inviting SSS to be able to share our policies, guidelines, and procedures concerning COVID-19 compensation benefits. This is my second time to join the Kapihang First time was sometime in October of 2020 while I was still under the leadership of your assistant treasurer right now, Dr. Brenda Viola. So to start off, allow me to refresh everyone with some of the salient features of our sickness benefit. Next slide, please. Per definition, sickness benefit is daily cash allowance paid to a member for the number of days he or she is unable to work, to report for work due to sickness or injury. So this is actually a replacement of lost income. However, it must be due to sickness or injury. That's why there is a need for a medical certificate, not to be issued by our fellow doctors. Even in mga dental cases can be filed also. So even the dentist can certify that the member had an injury or an illness due to some dental issues. Okay. Next slide, please. Okay. Being a benefit, meron siyang ilang qualifications for entitlement. Namely, yung confinement, no? First, which can either be home or hospital confinement. Hindi po siya limited just to to hospital confinement. However, the number of days must be at least 4 days of absence from work to be entitled to the benefit. Another qualification is the contribution. The member must have at least 3 monthly contributions within the 12-month period immediately before the semester of contingency. So let's say, for example, the member will be got sick this time around of the year, February. So the semester of contingency would be from October of 2021 up to March of 2022. So you do 12 months backward from October of 2021, you need only 3 monthly contributions during the 12-month period to qualify for sickness benefit. The third qualification is the company sick leave. This must first be consumed before filing for the benefit. However, the company sick leave is reflected upon filing of the reimbursement, not during the filing of the notification. So let me make myself clear again, no? It is only when you're filing for the reimbursement or that the company sick leave is asked from the employer. Kasi it must first be consumed before the member can be allowed to file for sickness benefit. The fourth would be the notification. As far as notification is concerned, the employee has 5 days from the start of confinement, in case of home confinement, to notify his employer. And the employer, on the other hand, has 5 days within which he or she has to notify SSS. Okay. But for hospital confinement, the period of notification will be 1 year from the date of discharge, meaning to say that the application or the notification must be received by SSS within 1 year from the date of discharge. So if the employee is able to meet all of these criteria, then the member is entitled to file for sickness benefit. Next slide, please. Okay, we now go to the COVID-19, no? Which is actually the main topic for this evening. So we do grant sickness benefit for COVID-19. However, the documentary requirements are as follows. There must be a confirmed RT-PCR result or an antigen result from a DOH accredited facility. Or in case of an antigen test result from a non-DOH accredited facilities, a certificate of completion of quarantine signed and issued by a licensed physician from the LGU or City Health is necessary. So
That is the reason why um, the positive antigen result must be conducted by a professional. Although we do not discourage the use of self-test kits, no. However, despite the use of self-test kits, the member or the employee must also consult a physician so that a medical certificate indicating the type of test kit that was used will be indicated. Okay, thank you. And then we move on to the next slide.
Okay na, sir?
Yes.
Slide.
Okay.
Thank
All
you,
right.
sir.
Okay. The following are the measures taken by SSS during the period of pandemic, no? First, we extended the period of filing of claims. As we said a while back, that there's a period of notification, which is 5 days or E to ER, and another 5 days ER to SSS, or 1 year from date of discharge in case of hospital confinement. But for the period during which we had a pandemic, we extended the period of filing of all claims with contingencies from March 1, 2020 up to the present. No, actually, this extension will be up to 60 calendar days from the lifting of community quarantine. And if ever that happens, so the employee need not fear kasi he or she has another 60 days pa from the lifting of the community quarantine to file their claims. Okay. And then in May of 2020, the online filing of sickness benefit reimbursement application was implemented, but was only for the SSS sickness benefit. So instead of the employers going to our branches to file their sickness benefit reimbursement applications or SBRAs, they were allowed to file it online already by using the module. But first of all, they have to be registered with my.sss to be able to access and the modules for the filing of the SBRA. Then next slide, please. Then late last year, on December 27, 2021, we launched the enhancement of the electronic sickness notification and the online filing of the SBRA. So by re-engineering our business processes, the filing of the sickness notification was made online so that there will be no need for the members or the company reps to go and submit the hard copies of the application forms, even though they have filed electronically. Okay. On the other hand, even the sickness benefit reimbursement application was also enhanced so that there will be a seamless transition from the filing or approval of the sickness notification to the filing of the sickness benefit reimbursement application. For this one, I will discuss further through a diagram what the online filing of sickness notification is. Next slide, please. So for the online filing of sickness notification, employers must have a registered account with a website, no? And then they must have an enrolled disbursement account through the DAEM or the disbursement account enrollment module. Third is that online filing of claims is the responsibility of the employer. Attempts by the employee to file claims personally shall result to rejection as the system would validate the filer's membership. Of late kasi, we have been receiving claims that are being filed by employed members, no? And they are filing it individually. So the system will validate, so it will be rejected lang din. So it is actually the duty of the employer to file both SSS and EC claims on behalf of the member. In case of easy claims, with the online filing, it is now the member that is directly paid. So there's no need for the employer to advance. And at the same time, the employee must have an enrolled disbursement account also. The employer must see to it that the employee has an enrolled disbursement account before filing for the easy claim. Next slide, please. All right. Here's the diagram that I was talking about. On the left side of your screen, it's the employer who will encode the required information, no? And once it is validated, the employer will be allowed to upload the supporting documents, namely the medical certificate, the COVID test result, or in case of rat result, a CCQ. The CCQ should be also included. And if the employee sought consult from a medical practitioner or the company physician, a medical certificate may also be uploaded. Okay. After uploading everything and submitting it online, the claim will be going to our medical evaluation center. There's a general inbox, no? So that claims from NCR may be evaluated by our medical evaluators from Visayas or Mindanao or Luzon, so that there will be a faster evaluation of the claims. So after the evaluation of the claims, in case of SSS sickness, it will be returned to the employer online also. Notice will be sent to the employer that the claim has been approved. And the employer can now advance the amount to the employee and at the same time file for the sickness benefit reimbursement application. This is the one on your right side. So that upon filing of the SBRA, the employee will be required to send a confirmation that he or she has received the advance payment made by the employer. By doing so, the online SBRA will then go to our processing center for payment of the reimbursement to the employer. On the other side, if in case this is an easy sickness, after the evaluation of our medical specialist, the claim will be directly sent to our processing center for payment of the benefit to the employee. So that is how the system works as far as the online filing of sickness goes. Next slide, please. Another is that to facilitate, I guess we have seen this slide already, no? But we just like to reiterate that a registered account is required from the employer and also from the employee, especially if in case the member is filing for easy claims. Okay, so this is available in the disbursement account enrollment module under the e-services of our my.sss account. I guess this is the last slide. So thank you very much for listening. Thank you.
Thank you very much, Dr. Putong. So we are very well informed of the updates also regarding the COVID-19. Now we have for the last speaker, last but not the least. So may we call on for our ECC, Attorney Villasoto, Attorney Jonathan Villasoto. He's the Deputy Executive Director of the ECC. Attorney?
Thank you, ma'am. Good evening po.
Have the floor. Yes po, virtual floor.
To the chapter president, vice president, other officers and members of the PCOM QC chapter. to my fellow resource persons, and to the more or less 550 participants from north to south, na imbag nga rabi, mayap abengi, marhay na banggi, ayan, to our friends in Visayas and Mindanao regions, maupay nga gabi, maayong gabi, maayong gabi. Okay, at magandang gabi po sa inyo lahat. Hope you are all in a good condition. Okay po. So, a while ago, our fellow presenters or resource persons have enumerated the benefits under the SSS and PhilHealth laws or acts. Ayan, no? So, maybe our participants are interested to know the reason on the grant of these benefits, particularly on the source of the effectiveness of these laws. Ano ba ang dahilan at bakit we have these types of social legislation? So, because of this document, my dear brothers and sisters, the 1987 Constitution of the Republic of the Philippines, under this Constitution, we have the social justice and human rights provision. How do we illustrate social justice and human rights? Legal bias or privilege for the underprivileged, or the primacy of human dignity over material things. And maybe our participants have already heard of this principle. Those who have less in life should have more in laws. Less in life, more in laws. Hindi po biyanan yan, mga kaibigan. Batas po yan. So, maybe we could say it in our native language. Ang pinagkaita ng karangyaan ay binibigyan ng higit na karapatan sa ilalim ng ating batas. Okay? So, going back to our constitutional provisions, of course, among the state principles and state policies could be found under Article 2, the protection and promotion of the welfare of our workers. So diyan lang ba nagtatapos ang provisions ng ating Constitution, particular sa labor? Wait, there's more. So we proceed to Article 13, Section 1, which partly provides that the state shall afford full protection to labor, local and overseas, organized and unorganized. Also, aside from that, there is a specific provision for the working women. Di pa nagkasya ang Constitution sa pagsasabi ng labor. Kinakailangan pa sabihin yung para sa ating mga kababaihan. Ano ang binabanggit? Article 13, Section 14. The state shall protect working women by providing safe and healthful working conditions, taking into account their maternal function. So yan po ang constitutional basis ng ating law on lactation and maternity leave. Okay? As a corollary to the constitutional provisions under the labor code, in all labor cases, in case of doubt, we have the liberal interpretation in favor of labor clause provision in the labor code. So if a labor law would be interpreted in more ways than one, that interpretation that would favor the underprivileged must be implemented also. And so far as employees' compensation claim is concerned, kung there is doubt kung either compensable ba ito or not compensable, so the claim should be resolved in favor of labor. So on the third paragraph po on the screen shows the state policy. Pakibalik po yung yan po in previous slide. So on the third paragraph po ng ating pong presentation, the third paragraph refers to the state policy. The provision on the granting of benefits for disability or death as a result of work-connected sickness or injury. So insofar as employees' compensation law is concerned, in the context of employees' compensation law, compensation refers to the payment of disability or death benefits due to work-connected sickness or injury. So next slide na po tayo. In the interest of time, i-dispense na po muna natin yung ating mga videos. At Okay, so insofar as compensability of sickness under the Employees Compensation Law is concerned, we have these general principles under the prevailing law and jurisprudence. So for a sickness to be considered as compensable, it must be either included in the list of occupational and work-related diseases or satisfaction of the increased risk jury principle, that the claimant must prove that the risk of contracting the disease is increased by the working conditions. So next slide po. Okay po. So what is the relevance? Ano po ba nagdi-distinguish ng mga illnesses na yan nakasali sa ating list of occupational and work-related disease? Ano ba yung advantage kung natin maituturing sa mga diseases or illnesses na included in that list? According to the Supreme Court, liberality in favor of labor. So, kaya kung nabanggit natin kanina, in case of doubt, resolve the same in favor of labor. So, otherwise, kinakailangan po niyang patunayan na yun po ang kanyang working conditions ang naging dahilan ng pagkakaroon niya ng sintomas ng naturang pagkakasakit. So, next slide po. Okay, ito po yung sentro ng discussion this time of pandemic. The credit po in the issuance of this our friends and to our friends from OSHC. So sila po ang nag-initiate ng pag-conduct ng study to determine po yung conditions for compensability of COVID-19. So after presenting po this proposed resolution to the various groups. So in March of 2021, the Employees Compensation Commission, the Commission, issued the Board Resolution number 21-04-14, enumerating po yung conditions for compensability of COVID-19. Any of these conditions may be alleged by the claimant subject to submission po of relevant documentary evidence. So going back to the issue of benefits under the Employees Compensation Law in this time of pandemic, maybe we can request our host to share on the screen yung pong animated video number 3. This is the topic number 3 in particular. Okay po, yung pong benefits under the EC program. Our animated video.
Nagkasakit o na-aksidente sa work? Don't worry! May ECC na handang tumulong sa'yo. Ang ECC o Employees Compensation Commission ay ang government agency na nagpapatupad ng ECP o Employees Compensation Program. Maliban pa ito sa makukuha mong benefits from SSS at GSIS. Kapag nagkasakit o naaksidente sa trabaho, merong loss of income benefit na pwedeng maklaim. Merong 3 klase nito. Una, temporary total disability o sickness benefit, kung saan ikaw ay nagkasakit o naaksidente at kinakailangan mong umabsent ng ilang araw hanggang 8 buwan. Pangalawa, permanent partial disability. Ito ay kapag may nawalang parte sa katawan mo o kaya function ito. Pangatlo, permanent total disability o yung kapag di ka na makabalik sa trabaho dahil sa sakit o aksidente. Maliban sa loss of income benefit, meron ka pang makukuhang medical benefit from ECC. Ito ay reimbursement sa mga nagastos mo sa gamot pati na rin sa ospital at medical care. Kung ikaw naman ay nagkaroon ng permanent disability, may karagdagang benepisyo ka pang makukuha mula sa ECC. Ito ay ang Carrier's Allowance, kung saan magkakaroon ka ng karagdagang 1,000 pesos per month. Kagaya ng SSS at GSIS, mayroon ding death and funeral benefits mula sa ECC kung work-related ang sanhi ng pagkakamatay ng employee. Sa private sector, doble benepisyo ito dahil iba pa ang death and funeral benefits ng ECC sa SSS. Samantalang sa public sector, ay funeral benefits lamang ang pwedeng sabay na i-claim. Pagdating sa death benefits o pension, ay pipili ang iyong beneficiary kung EC o GSIS benefits ang kukunin. Ito ay dahil sa exclusiveness of benefit policy ng GSIS. Maliban pa sa mga yan, meron ding rehabilitation services ang ECC para sa mga PWRDs o persons with work-related disabilities. Kabilang sa mga rehab services na ito ay free psychosocial support, physical o occupational therapy, vocational at livelihood training, at assistive devices gaya ng prosthesis at wheelchair. For more information, pumunta lang sa pinakamalapit na ECC office sa inyong lugar. Remember, kahit may ECC, lagi ka pa rin mag-ingat ha!
Okay, thank you. In summary po, may we provide the following fundamentals of the Employees' Compensation Law. EC benefits are distinct and separate from SSS, GSIS, PhilHealth, and other social legislations. SSS and GSIS benefits refer to non-work-related cases, whereas EC benefits point to work-related incidents. So, insofar as the agencies that are involved in the implementation of EC program is concerned, the SSS and the GSIS serve as the administering agencies of the Employees' Compensation Program. SSS for the private sector, GSIS for the public sector, and ECC serves as the appellate and policy-making body of the Employees' Compensation Program. There are two types of benefits under the Employees' Compensation Program: disability and death benefits. Disability and death benefits. So the primary purpose of the Employees' Compensation Law is to provide compensation for disability or death due to work-connected sickness or injury. In summary, benefits for work-related incidents. So, my dear brothers and sisters, thank you for listening. At hopefully po, at kung may any clarifications po, ay i-accommodate po natin during the open forum. Salamat po.
Thank you and salamat po, Attorney Jonathan Villasoto. So, we are now going to open the virtual floor para sa inyong mga katanungan. Mamaya ko na po isa-summarize kung ano po ang ating na-discuss, pero mas maganda po kung makapagtanong na po tayo. Marami na pong na-receive na tanong sa ating chat box. We have received many questions in the chat box. So we cannot probably answer everything, but I will start with the first one. Actually, dito po sa isang chat box. I think it's directed po sa ating PhilHealth. Okay. So for PhilHealth, will home care package be considered if the face-to-face consultation will be at the end of the isolation period? So nagtatanong po yung mga, nag-teleconsult. And then po, naging face-to-face na po at the end of the isolation. So anyone from PhilHealth, either Ms. Ma'am Merla or Ma'am Abigail? Sa ating first question, would like to answer?
Thank you, Ma'am Marilu. I think I can
Yes,
answer
po.
the question. So, for the home isolation package po, kailangan po yung ating face-to-face consultation ay during the isolation phase, no? Kasi kung after na ng isolation, hindi na po siya kasama dun sa provision ng benefit package. So, during the isolation, 10 days po yon. Within that 10 days, dapat po yung face-to-face consultation has to be conducted. At kagaya nung nabanggit ko kanina po na pwede naman siyang teleconsult. So, kailangan po within the period ng isolation.
Period.
Thank you.
Hindi up the end. Okay. Salamat po sa kasagutan na yan. And thank you for that answer. For the benefit of those who may not be speaking our vernacular. So, how can home care package be availed of by the unemployed patients? Kung may mga unemployed po, pero may PhilHealth dependent, whatever, pero silang PhilHealth din po.
Yeah. Yung benefit package naman po ng PhilHealth is kung unemployed ka naman but you have meron ka namang eligible ka naman for benefit package, makaka-avail naman even your dependents. Meron lang kasi yun yung kailangan nating emphasize sa ating member, no, na kahit sinabi ng UHC Act na the members are eligible, may immediate eligibility, but then again, kailangan as a member, responsible ka pa rin. But dun sa tanong niya, makaka-avail pa rin po siya ng benefit kahit unemployed na siya. as long as
Unemployed.
eligible.
Okay.
Yes po.
Eligible, oo. Yung mga criteria na sinabi niyo po kanina. Okay. Thank you,
Opo.
ma'am.
Thank you.
Tumungo po tayo sa ECC, sir. Or SSS siguro po ito dahil ang SSS ay meron po tayong guest, Dr. Putong. What is the time period for the application for compensation? May time frame po ba sinusunod sa pag-a-apply? Baka makaligtaan, lalo na po ngayon, pandemic, marami po nang makakalimutin. Hindi nakakapag-file. Opo.
Yun nga po, we have extended the filing, no? We have extended the filing of the claims. Parang wala po siya munang late filing as of the
Walang late
moment,
filing.
no? And it is up to 60 days from the lifting of any quarantine na applicable po yung ano na yan, extension of the filing. 60 days from the lifting of all community quarantine. So, yun po yun.
Okay. So, pwede po. So, narinig po natin ang sagot na na-extend po. So, yung late filing po ay hindi po kino-consider. Meron po extension.
Ma'am, can I just clarify? But
Yes
these
po.
are for contingencies from March 1
Yes.
of 2020, no? Yun lang po. Baka,
Yes, yun po.
baka ang
Yun lang po
ipa-file
yung
po is
start.
prior to March 2020. Hindi na po siya may pwede.
Ay, hindi
By
na.
this time. Yes po.
Nag-start lang po kasi 2020 po, March 3, di ba
Correct.
po? Yung
Correct
ating
po.
mga pandemic talaga. And ang May 2020 naman ang mga corporate, mga establishments po. Ano po?
Yes, that's right.
Okay. So, thank you so much, Dr. Putong. Yung iba po, mga scenarios po ang tinype nilang questions, but later on, ang advice ko po sa inyo, i-direct natin po to sa mga agencies. Okay? Kasi pagka scenario po, baka mahirapan sumagot. But we will choose the more appropriate po yung pwede masagot sa time constraint po na meron tayo. But we still have time for questions. Ito po ay pwedeng sagutin na kung sino man. Can RT-PCR testing be reimbursed or sa PhilHealth to be done as an outpatient? Sa PhilHealth po ulit, RT-PCR testing. May pinakita si ma'am na table kanina, mga reimbursements.
Yes, ma'am. For the RT-PCR, it can be paid on an outpatient basis as long as the patient is categorized doon sa ating DOH memo na subgroups po, no? So, sila po kasi yung mga at-risk individuals. So, basta nakasama sila doon sa subgroups, kahit gawin niya on an outpatient basis, and also that yung ating laboratory ay DOH license or PhilHealth accredited. So, they can avail of that benefit.
Okay. Meron pa po isang katanungan. It is for SSS. What are the requirements? For instance, yung isasubmit po, those who are unemployed but who got COVID-19, kaya lang naka 120 months na, actively paying but contributed for more than 120 months. So, naka-complete na po siya, kaya lang unemployed. So, nagka-COVID-19, still nagpe-pay pa po siya. So, may requirements po ba na in a nutshell, kahit overview lang po?
Yes, ang isa po sa qualification ang isa po sa qualification for the entitlement for the benefit is that at least meron siyang 3 monthly contribution 12 within the 12-month periods before the semester of contingency. So yung sinasabi po niya na 120, this might be yung overall niya, but let's look back 18 months before now, wala po siya ng 3 monthly contributions, hindi po siya magka-qualify for sickness benefit lang po. Yun po yun. Kailangan may, kumbaga, parang may recency of contribution.
Yes.
Okay.
Kaya dapat patuloy pa rin maghulog.
Patuloy po natin maghulog tayo.
Di ba po, quarterly po yun, di ba? Yun ang advice.
Yes.
At least, per quarter may naihulog po. Once every quarter. Kung complete na ng 120 months. Ano po?
Yes. Ang
Okay.
120 months
salamat,
is
Dr.
for the
Putong.
retirement. Ang 120 is for the retirement.
For the retirement benefit.
But for sickness benefit, you must have an active contributions. Okay.
Yes. Thank you so much, Dr. Putong. That will enlighten our audience po ngayong gabi. Isa pa po para sa SSS, idugtong ko na po kasi habang nasagot po yung isang tanong, will SSS accept the medical certificate issued by the private physician who managed the patient during the entire isolation period, or should it only be from the LGU physician? Mako-cover po ba?
Yes,
Hindi.
the medical certificate may be accomplished by any physician, no? For
Any
that matter.
physician.
Yes, hindi naman po limited to our government physicians.
Okay.
Ah,
LGU. Oo.
we-
Kasi
we-
minsan po
oo.
wala.
Yes, mahirap nga din daw po. Maybe what the question was about is yung certificate of completion of quarantine. So that
Ano
is
po
the
ito?
one.
Management.
That is the one issued by the LGUs or the City
LGU.
Health. But our medical certificate or any medical certificate na may be accomplished, of course, by practicing physician, no, and submitted to us as proof that they got sick. It's a proof na required po namin.
Required po yun. Okay.
Yes
So,
po.
thank you so much, Dr. Putong. Now, for ECC, Attorney Jonathan, most of our EC claims are returned due to lacking documents. But it is not actually lacking because we make sure that everything is included sa claim application. In relation to this, can ECC po, pwede po bang i-clarify what should be actually expected na ma-include po sa accident sickness form for an EC claim for COVID infection? Do we really need to know how the employee got the infection? Close contact, o sa shuttle, ganun po. Nakita natin yung requirements na kanina po di ba?
As to the requirements, maybe we can refer po to Doc Bob. Sila po ang implementing agency. But insofar as
okay.
po,
yes, sir.
sila po ang may initial, tinatawag na initial jurisdiction in all employees compensation claim. Kung i-deny po, kung magkaroon ng denial, ang SSS, sa branch, sa main office, kami po yung appellate body. So, so far po as requirements are concerned, ito po yan ang sa ating kaibigan sa SSS. But in so far as conditions for compensability as concerned, we have 4. So as mentioned po, we have any of those conditions may be alleged. Subject nga lang po sa submission ng relevant documentary evidence. Ano po yan? Yung mga conditions na yan, unang-una, yung po mga kababayan natin na nagtatrabaho sa hospital, sa isolation facilities, or laboratories. Ano po? And then, yung po mga kababayan din natin, ang patients entail frequent exposure to the public. And then third, yung pong gumagamit ng mga public transportation in going to and coming from work. No? And then fourth, yung pong kung nagkaroon po ng transmission sa ating po mga workplaces. So any of those conditions po may be alleged. No? Subject nga lang sa submission ng relevant documentary evidence. In compliance po with the Supreme Court pronouncements that lahat po ng mga illnesses na yan nakasali sa list of occupational diseases, occupational and work-related diseases to be exact, ay nag-i-enjoy po yan ng disputable presumption. So in the absence of any clear and convincing evidence to the contrary, pwede po yan makonsidered as compensable. Ayan.
Okay. Opo. So thank you so much, Attorney. So going back to SSS, kasi Dr. Putong, kasi andun yung mga kulang yung napafile o ano po ba yung masasabi niyo po doon sa question na yun?
Basically, almost the same ang sa SSS and sa EC as far as COVID is concerned, no? We do have the RT-PCR result from a DOH accredited facility plus a medical certificate. Now, in case nga po RAT ang ginamit o yung rapid antigen, it must be FDA approved. Otherwise, kung hindi naman natin masabi kung ang ginamit ba ng practicing physician, no, is FDA approved, kailangan na lang po na ito may accompanying certificate of completion of quarantine. Kasi at the moment po nag-positive yan, dapat kapag ang ginamit po ay yung test kit, yung RAT, no, ini-inform po ang LGU, ang barangay, or ang city health, so that makasasama siya sa census and everything. So basically, parehas lang po ang SSS and EC documents, no?
Tama po. Okay. Thank you, Dr. Putong. May question pa rin pa po para sa SSS and ECC. So for the workers who were not able to file, hindi raw po nakapag-file ng claim last year. And the company physician, wala na po doon, nagpalit, nalipat, or can the incumbent company physician accomplish the SSS notification of the said worker who got sick of COVID? Nagpalit na po, hindi siya ang nag-manage. Pwede pa rin po, i-honor niyo po yun.
Oo, ang ano lang naman ho natin right now po, the sickness notification form is hardly used, no? Kasi online na po ang filing. So, ang mangyayari po is if the incumbent will be using the sickness notification form, kasi incorporated po sa form na yan yung medical certificate. So, maaring yan po ang meron sila, then yun po ang i-upload na document po as part of the requirements na hinihingi namin. But the notification form per se, hindi na po pinagagamit yan as much as possible.
Hindi na pinapagamit.
Kasi online na po tayo. So, after after po ipasok yung mga information na needed, yung start ng confinement, the number of days na kiniklaim, na nagkasakit, then they have to upload the supporting documents such as the medical certificate, the RT-PCR result, or the rat test, if the case may be.
Yes po. Thank you, Dr. Putong. There's a question po sa PhilHealth. It's for PhilHealth. Is there a limit on the PhilHealth availment for same diagnosis in card by the worker? Pareho po, paulit-ulit na lang po. O na reinfection po ng COVID. Si Ma'am Abigail or Ma'am Merla? Anyone po? Para sa PhilHealth. May limit po ba? Nagka-reinfection, tapos reinfection na. Marami pong kilalang ganon. Kahit nga kapwa-doktor, pangatlong reinfection na po. So, paano po ba yun?
Currently po, wala naman pong limit on the availment, particularly for COVID, kasi nagkakaroon talaga ng occurrences ng readmission.
Yes,
so, wala naman po ngayong limit on that. Pero syempre, parang kung yung appropriate care was provided to the patient, no, syempre mas ayaw natin na pabalik-balik siya sa hospital. So, kailangan assure tayo na of quality yung direct management ng patient. Hindi nga lang maiwasan na kung talagang kailangan niya ma-confine uli dahil yung iba kasi talagang minsan 3 times nagpa-positive sa COVID, no? Swerte lang
healthcare
kung
worker.
Opo, swerte lang kung mild case siya at pwedeng nasa isolation facility. Pero kung inpatient, wala naman po as of now. Thank you.
So wala po limit. Thank you so much, ma'am. At another po, meron pong related sa PhilHealth. Yung mga PhilHealth accredited physicians, can they charge PhilHealth for telemedicine, teleconsults, virtual consultation po? Kaya po ako, isa sa mga nagpa-practice po talaga since nagka-pandemic, puro telemedicine po talaga in both companies where I work for po. So, Ma'am Abigail, makaka-charge po ba kami?
Sorry po, ma'am. Hindi ko nakuha yung tanong. Ano po ulit?
Halimbawa po, PhilHealth accredited physicians po, nag-charge po sila sa virtual consultations nila. Kasi kadalasan po hindi, di ba? Tsaka magbayad nga GCash, may mga private patients din po namin. Pero PhilHealth accredited po, mga physicians. But can they charge po sa virtual? Hindi sila kasama sa teleconsulta, hindi sila kasama dun sa mga platforms po na it's an individual, I think, na based sila mismo as a private practitioner po. Yan. So, merong teleconsultation nangyayari. Makakapag-charge po ba sila nun? Pag nag-file po yung
sorry po. Apo. So, for doon sa home isolation, kasama po kasi yun sa benefit package. As long as yung ating healthcare professional ay part ng team for home isolation. So, ina-identify yun ng accredited home isolation provider. But for other consultation, for other conditions, pinag-aaralan pa po as of now ng PhilHealth yung telemedicine na mechanism. Kasi yun nga yung mas easier ngayon po, no? So, under study pa po ng PhilHealth.
Under study. Yan. So, nasagot na po yung tanong sa ating mga participants. Meron pa pong karagdagan sa PhilHealth for COVID home isolation package. Can the private clinics claim this if they were the ones to monitor their patients sa isolation? Sila po mag-claim mga marami na po ngayon nag-offer ng home care package, di ba ma'am? Halos lahat ng hospital, meron na po. So pwede sila mag-claim din para sa patients sila. Minomonitor nila yung mga patients in isolation. Yung iba nga, nag-face-to-face, pinupuntahan, home service. Po.
For PhilHealth po, for home isolation, kailangan po kasi, accredited kasi yung healthcare institution. Hindi siya nakahiwala yung provider, yung professional. So dapat po, part po siya ng team na identified ni accredited healthcare institution. So for the professional fee na provided nitong doktor na to, sila po under po ng healthcare institution yung magiging negotiation nila on that payment. So kailangan kilala siya or part siya ng team ng accredited healthcare institution.
Okay po. So, meron pa po dito, no? I think this is for both SSS and ECC. Si attorney can also comment. If nabayaran na po ng company ang worker nila na nag-isolate or quarantine, pwede pa ba mag-file sa SSS and ECC? Nabayaran na ng company? Additional filing. Maraming ganyan. Nagpapapirma. Kahit sa akin, nagpapapirma.
Nabayaran na the days na nag-absent.
In terms the leave, yes po. Yes. Meron pa siyang leave benefits.
Oo. As far as SSS is concerned, the moment po na nag-advance po ang employee, pero ang employer rather, but wala pa yung na-file sa amin na notification, that will be a problem kasi hindi po natin alam yung number of days na i-approve for that particular claim. So, ang ano ho talaga dyan is to file first the notification para ho sa ganon, the employer will know how many days dapat ang i-compute na i-advance for the employee. Pero I have a problem pagka nauna mo na nag-advance without approval of
yung
SSS.
employer.
Yes, medyo mahirap po yung ano. Baka mamaya, what should have been given was yung company sick leave, rather. Inuna mo nang bigay yung company sick leave.
Tama.
Then saka pa lang ipa-file yung other benefits from SSS naman.
Yung Opo, ayan. Thank you so much, Dr. Putong.
Ang ECC po, wala naman po silang sorry
wala naman masyado.
Ang ECC, they do not require the company sick leave na kailangan used up right, attorney?
Oo, sa SSS yun.
Sa ECC po, parang hindi ang company sick leave that dapat used up.
Yeah, dapat used up. Okay. So, meron po pong sa ECC, kaya pa, no?
May oras pa po, dagdagan ko lang po yung nabi ni Doc Bob.
Attorney.
Points to the granting of EC benefits for those employees who contracted COVID-19 despite the fact na nag-grant po ang kanilang mga employers ng allowances or pinasweldo pa po sila despite po na nasa isolation period po sila. Ayan, So ito po yung may mga COVID-19. So considering ng ating pong program refers to disability or death due to work-connected sickness or injury. So kung may proof tayo na nagkaroon po tayo ng pagkakasakit, mapatunayan po natin na yan ay work-related. Yan po ang primary purpose ng batas. Nagkaroon po ng disability, hindi po nagkaroon ng pagkakataong makapag-perform ng duties dahil nga po sa disability na yan ay bibigay po ang benepisyo. Considering na ang purpose po ng ating programa ay work incident-based. So despite po na mayroon pong separate benefits, pinasweldo pa sila yung gratis, ng kanilang mga employers. Relevant po yan sa ilalim po ng Employees Compensation Program. Sa kadahilanan po, in comparison po sa SS benefits, hindi po tayo nagbibilang ng kung ano mang leave benefits. So kung dahil nga po ang coverage natin on the first day pa lang. So wala po tayong pinag-uusapan dito na pinasweldo ka ba o binabayaran ka ba? Ang question lang po natin dito, work-connected ba? Ayan po.
Work-connected ba? Oo, tama po. Salamat, attorney, for adding that po. Sa PhilHealth, tumungo po tayo. Meron po ba tayong stats or status of availment po nitong mga ano na po, itong mga benefits pong ito. May status po sa workplace. Kasi workplace po kami lahat, occupational physicians, mostly attending. So may stats po tayo na malaki po pang availment dito sa mga packages na to since nagkaroon tayo ng mga surge. Since maybe 2021 kung may data po kayo, 2020.
Meron naman pong data ang PhilHealth kasi doon sa mga applications naman, nakakategorize kung siya ay under ng category ng employed. Opo. Pero I don't know lang po as of this session kung ilan na, gaano na kadami yung employed na mga Filipinos na nag-avail ng COVID benefit.
So let's say ma'am, meron kayong ballpark estimate na parang 50% sa lahat na application, ganun po? Wala naman. Wala pong parang ganun.
Wala po opo. Pero if ever you want to request po nung actual data, we can provide naman po.
Yeah. Kasi alam niyo ma'am, maganda rin makita kasi kung nag-a-avail sila, alam nila na pwede pala mag-avail. Kasi iba ma'am na-encounter ko, hindi alam Ay, may ganun ba, doktora? Oh, meron ang PhilHealth. So, home care, saan ka ba nag-home care? So, yun po, marami pong di nakakaalam kasi.
Yes,
salamat po, ma'am.
Sana nga po, mas scale up namin yung communication para at least malaman din ng mga members kung ano yung mga benepisyong para sa kanila.
Yes, ma'am. Nakatapos na sila ng home isolation.
Isolation. Kahit naman po, actually isa ako sa hindi naman naka-avail. Thank you po.
Okay, thank you, ma'am. Tapos for ECC, employer certified a worker's COVID infection as work-related after all the EC conditions were met. However, for their evaluation, ang said worker pong yan, I was actually exposed to confirmed family member. Compensable pa po ba yan? Kagulatan.
Marami pa pong dapat i-consider na factors dyan. At,
correct.
Hindi po tayo makakapagbigay ng kung ano mga concrete answer sa mga binigay pong facts. Wala po kasi hard and fast rule pagdating sa medical evaluation. On a case-to-case basis pa rin po yan. At well, anyway, yung pong kung may nabanggit po na kung ano pong sinabi na employer, either work-related or not work-related yung COVID-19, ay ano lang po yan, pagdating sa evaluation, that remains an opinion po yan pagdating sa mga evaluators. The evaluator may consider the same or not. Ano po? Base sa available evidence, doon po sila magbabase kung compensable po under the employer's compensation. Okay. So despite po na nag-issue ang ating mga employers na hindi naman work-related yan, nakuha mo sa bahay. So ano pa rin po, pagbabasehan pa rin po yung remaining relevant evidence ng ating po mga empleyado. Hindi po binding na sinabi ng employers na hindi yan work-related.
Right, opo. So, marami pa pong katanungan, kaya lang po hindi kaya ng oras. Hihiling po lang sana ako po, on behalf of the PCOM Quezon City Chapter, ng mga take-home messages po, 1 or 2 liners po sa inyo.
Okay.
We'll start with, from PhilHealth. Let's start po with PhilHealth. Si Ma'am Merla or Ma'am Abigail. Take-home message po para sa ating audience.
Can I request Miss Merla?
Okay.
Sige po.
Sige.
Magandang
Miss Merla.
Thank you,
Spotlight si Miss
Doktora.
Merla.
Okay.
Yes,
Message po namin para sa lahat. Alamin po natin ang ating mga benepisyo. Alamin po natin yung mga polisiya na nakakibat ng benepisyong ito para naman po magamit natin at ng mga dependents natin o beneficiaries ng PhilHealth. Yun po. Maraming salamat po sa pag-imbita nyo muli sa PhilHealth and mag-ingat po tayong lahat.
Thank you so much, Ma'am Merla. Now, let's hear from Ma'am Abigail. Si ano na, no? Okay, Ma'am Merla na. Dr. Putong of SSS. Sir, kayo po.
Yes,
may take-home message
thank you.
po kayo para sa ating participants.
Yes po, yun lang we'd like to encourage everyone to use yung online filing. Nang sa ganun, you don't have to go to our branches. Masyado mahaba ang pila. But right now, I also would like to apologize kasi grabe ang surge ng mga claims online, no? The usual namin na 1,000 to 1,500 a day, pumapalo na po siya ng 4,000 a day ang nagpa-file online. That's why we're trying to find means na mapabilis namin yung turnaround time ng mga claims na napa-file sa amin. So we apologize na medyo nagkakaroon ng delay from the expected namin na 5 days dapat na-evaluate na namin yung claim. But please continue to
online.
To do the online filing na lang ho. Kasi for the employed, wala na po kaming over the counter. It's purely online effective January 27. Thank you.
Thank you so much, Dr. Putong. And last but not the least, from ECC, Attorney Jonathan.
Salamat
Take
po
home
sa
message.
invitasyong binigay ng PCOM QC chapter. Ito po siguro yung post-Valentine presentation. Opo. At to our dear brothers and sisters, higit po sa benepisyo. Kaya mag-ingat po tayo sa lahat ng pagkakataon. Magandang gabi po at salamat po sa inyong lahat.
Opo. So, ngayong gabi po ay natunghayan po natin ang COVID-19 benefits, maging yung sa COVID-19 vaccine injury compensation na dapat nating alamin, mga AEFI, at ang SSS medical benefits po na inilahad po ngayong gabi. And finally, from ECC, tandaan po natin yung mga criteria na binigay po sa atin. Dapat workplace talaga related bago magpa-file. So, our 37th Kapihang OH is again a success, not because of PCOM Quezon City chapter, but because, first of all, for our esteemed speakers for tonight. So, pwede tayong mag-reaction ng palakpakan. Reaction lang po walang papalakpak. And also po, to you, our audience. Tulong sa Manggagawa sa gitna ng pandemya, a panel discussion with SSS, PhilHealth, and ECC. So, pwede na po sigurong i-flash na po natin sa screen ang ating awardee. So, may I read? Philippine College of Occupational Medicine, Quezon City Chapter, presents this certificate of appreciation to Attorney Jonathan T. Villasoto, Deputy Executive Director, Employees Compensation Commission, for serving as resource speaker of the Chapter's 37th Kapihang OH, Tulong sa Manggagawa sa gitna ng pandemya, a panel discussion with SSS, PhilHealth, and ECC, signed by, given the 16th day of February, and signed by Jose Angelo C. Taylor, MD, Chapter Secretary, and Catherine S. Artayes Carriaga, MD, Chapter President. The next certificate, the same says, and now to Dr. Roberto U. Putong, Department Manager 3 of the Social Security System, with the same signatories. And of course, to our lovely ladies tonight, and for representatives ng PhilHealth, Ms. Abigail Romero-Estrada, NPARN, Head of the Product Team for Inpatient Benefits, and same signatories. And also, finally, to Ms. Merla Rose David-Reyes, Head of the Product Team for Special Benefits of the Philippine Health Insurance Corporation, with the same signatories. So, palakpakan po natin sila, and thank you very, very much for gracing also our 15th anniversary po ng PCOM Quezon City Chapter. So, thank you so much. Bigyan natin po ng i-heart natin sila or whatever, reaction, palakpakan, kasi po napakagaling po at tayo po ay na-enlighten lahat. Sa mga katanungan po ninyo na nasa chat box, we will try as much as possible po to direct them, or we have our agencies po, yung mga nilagay nila po na how to contact them. Tama po ba? So, salamat po ulit. Papasalamat din kay Attorney Jonathan Villasoto of ECC, sa SSS po kay Dr. Putong, and Ma'am Abigail Estrada, and Ms. Merla Reyes of PhilHealth. Okay.
Then po.
Thank you po.
Thank you so much. Thank you. Thank you.
Thank you so much, everyone. No, it's very invigorating na topic tonight. Everyone gave it, binigay nila lahat ng kanilang kaalaman sa SSS, PhilHealth, and ECC, no? I hope marami tayong natutunan tonight. So, thank you, QCC Virtual Kapihang team. Excellent job to everyone. Pinapangunahan po ng aming technical head na our very own PCOM QC Chapter Secretary, Dr. Jose Angelo Taylor. Maraming salamat sa mga nag-participate ngayong gabi. Sana marami tayong natutunan. Mangyari ay huwag munang umalis, no? At magbabatian tayo sa dulo. Now, to formally end our tonight's educational activity, ladies and gentlemen, our chapter Vice President, Dr. Jeremias Martin Florante.
Thank you very much, Dr. Gox. Okay. During the last Kapihan, several questions actually arose on the benefits of the workers affected by the coronavirus disease 2019 or COVID-19. Though we have featured the same in our earlier Kapihans,
Okay. Pasensya na, no, ang mga net natin. Ewan ko anong meron ngayong gabi. Post-Valentine's traumatizing moment. Wait lang natin na kumapit ang net ng ating Vice President.
thank our resource persons, Mrs. Abigail Estrada and Merla Rose Reyes from the Philippine Health Insurance Corporation, Dr. Roberto Putong from the Social Security System, and Deputy Executive Director Jonathan Villasoto of the Employees Compensation Commission for imparting to us some tips and advice to better guide our workers during its 15th founding anniversary. We have a lot to thank for. From our pillars, Assistant Secretary Maria Teresita Coqueco of the Department of Labor and Employment, and the college's past presidents, Drs. Marilyn Alentahan and Oscar Santiano, to our founding chapter president, Dr. Natalio Alegre II, and the incorporators, to the general membership of the college and the chapter, to our industry partners, and to the Occupational Safety and Health community. Without your trust and unwavering support, Quezon City chapter will not grow this big. Again, our heartfelt thanks and appreciation. To the men and women behind this Kapihan, kudos for a job well done, as always. Tonight is also the premiere night of our 36th Kapihang OH on our official YouTube channel. If you have not subscribed yet, please subscribe now and hit the notification bell for you tweeted. Don't forget to like and follow our other social media accounts on Facebook, Twitter, and Instagram. If you have comments and suggestions for the next topic, please do not hesitate to contact us at PCOM Quezon City Chapter at gmail.com. Always remember that in Quezon City Chapter of PCOM, we value your safety and health. Hashtag PCOM QCC Cares. Good night, everyone. Ingat.
Okay, maraming salamat, Dr. Jeremiah Florante, Dr. Jing, our PCOM QC Chapter Vice President. Again, I would like to thank everyone and invite everyone to our official Facebook page, follow our Twitter and Instagram account. Please don't forget to like, subscribe, share, hit the notification button for our official YouTube channel at nandyan sa ating screen. Okay? Meron ba? O yan. Muli, maraming salamat sa inyong pagdalo sa ating mga very distinguished guests. Maraming salamat po sa inyong time at napaunlakan niyo po kami.